So you've been diagnosed with prostate cancer, and now it's time to think about your various options for treatment. One of the most important questions is to think about, where is your cancer located? Although doctors may think that it's confined in the prostate gland, sometimes that is not true. Some men have cancers that have gone outside the prostate into the seminal vesicles, possibly into the lymph nodes. And if we could give you a good estimate of the chances for that having spread, it may influence or be helpful to choose a treatment that is most appropriate for you. So how do we do that? Well, we use three things. We use the PSA, we use the clinical stage, and we use the Gleason score from the biopsy. Those three combined can be used to predict where the cancer is located. Tables have been developed. One in particular is called the Parton tables, and that information is available on the internet at the location shown on your screen. Any man can check that out and find out, before he's treated, what are the odds the cancer is inside the prostate, what are the odds it's growing through the wall, into the seminal vesicles, or maybe even into the lymph nodes. In general, the lower the Gleason score and the lower the PSA, the lower the chance that the cancer has spread. Most of the men we diagnose in the United States today have a Gleason score of 6, a PSA under 10, and a clinical stage in which the cancer can't even be felt. We call that stage T1C. For a man that has all three of those characteristics, he has about an 80 to 90% chance the cancer is confined. He has less than a 1% chance that the cancer is in the lymph nodes. That information can be used to decide what treatment is appropriate. For example, in those circumstances, taking out the lymph nodes would make little sense because the odds of needing that are extremely small. On the other hand, if a man has a PSA greater than 10, if he has a clinical stage of T2B, or if he has a Gleason score of 8, 9, or 10, those combinations are much more likely to be associated with cancer that's growing outside the wall and possibly into the seminal vesicles or the lymph nodes. The best thing that you can do is get this information and use it to help decide which treatment is most appropriate. It's no longer a good idea to simply assume that all cancers are going to behave the same way. If your cancer has a high chance that it's growing outside the wall of the prostate, taking out the prostate may not be the best treatment. On the other hand, if it's growing into the lymph nodes, then you may need a more extensive therapy. So the bottom line here is to realize that it's possible to predict or estimate the chance that your cancer is localized, growing outside the wall, into the seminal vesicles, or in the lymph nodes. And that information should be used as you plan your therapy.